Hello everyone, my name is Vestine Yakabumde. Today we are going to talk about patient falls at Kettering Health Hospital. Kettering Health is a faith-based non-profit healthcare system and a family of medical centers, emergency centers, and outpatient facilities with a promise to follow in Jesus' steps by guiding every person to their best health. Kettering Health Main Campus was the first hospital in Kettering Health and was founded in 1964 by Eugene Kettering and his wife Virginia Kettering. Kettering Health logo symbolizes unity, strength, and power of all employees and physicians working together as a team to transform the healthcare experience. Kettering Health tagline "Be Your Best" gives all employees and physicians something to aim for, to aspire to, and to strive for. Five principal values can define Kettering Health, and which are caring, competent, collaborative, trustworthy, and innovative. Kettering Health's mission is of improving people's quality of life in the communities they serve through education and healthcare. Kettering Health's vision is to be recognized as the leader in transforming the healthcare experience. Like in any other healthcare organizations, patient falls is a concerning issue at Kettering Health. For this reason, patient safety is their top priority. Brain and spine unit is one of the hospital units with high number of falls, and in this we are going to discuss patient falls in brain and spine in this unit. Leah Halfgarden is the assistant nurse manager at Kettering Health in brain and spine unit, and she's the one who helped with all the information with the project. As I said earlier, brain and spine unit is one of the hospital's units with the highest number of falls. This is because most patients in this unit are cognitive impaired, confused, physically impaired, and impulsive. In the whole year of 2021, February and May are the only months that brain and spine unit had zero patient falls. April and September were the months with the lowest number of falls, with 2 falls each month. October was the month with the highest number of falls, with 9 falls. Due to cognitive impairment, the patients on this unit don't remember that they are physically impaired, so they try to walk without assistance, which most of the time results in a fall. On most falls that happen in this unit, bed alarms are on, but the patients are impulsive and very fast to get up, and by the time the bed exit is answered, the patient is already on floor. Patient falls are a common and serious complication of hospital care, especially in elder patients. Despite many years of worldwide efforts on preventing patient falls, there has been an increase in patient falls. Most patient falls occur in bathroom or near the bedside, most especially among mentally confused or physically impaired patients and those with greater comorbidity. Patient falls have been the largest category of reported incidents in hospitals and other healthcare facilities. More than one third of in-hospital patient fall result in injuries and can include serious injuries such as head trauma and fractures. Patient falls prevention is a national patient safety goal for both long-term care facilities and hospitals. At Kettering Health, patient safety is the top priority and fall prevention is one of the hospital goals. In brain and spine unit, patient falls prevention efforts begin with assessing each patient's risk for falls. This is done using clinical prediction rules for identifying high risk patients. Most falls occur in elder patients who have baseline difficulties with strength, morbidity, or balance, especially those who are experiencing delirium. However, non-elderly patients who are actually ill can also be at fall risk. At Kettering Health, fall prevention measures are individualized, meaning that there is no one-size-fits-all method in preventing falls. This means that there is a way of preventing falls for each individual patient depending on their fall risk number. Environmental measure of preventing falls is used in the brain and spine unit. This measure includes things like using the standardized risk assessment tools, non-slip stacks, or ensuring that patients are within nurse's line of sight and using bed alarms or lowering the bed's height. Qualitative tools are needed in the brain and spine unit because with qualitative tools, ideas are produced, priorities are set, direction is maintained, causes of, causes of the problem are determined, and processes are clarified. Fall prevention is brain and spine top priority. Fall prevention is brain and spine unit top priority. But despite all the efforts in preventing them, there is still a big number of falls. Study shows that most falls in the brain and spine unit occur on patients who are cognitively impaired, confused, physically impaired, and unable or unwilling to follow commands or directions. Because most of the patients are confused, they forget that they are physically impaired and try to get up on their own, which most of the time results in falls. Brainstorming is needed in a brain and spine unit for quality improvement implementation. Both structured and unstructured brainstorming techniques are needed in fall prevention because most falls in this unit occur on cognitive impaired patients. Measures like hourly safety rounds, hourly checks with toileting, topside rise up, and placing the most confused and the most impulsive patient close to the nurse station will help in preventing falls. According to my findings, despite all the interventions in preventing them, patient falls remain the main concern in both hospitals and in long-term care facilities. More than one third of in-hospital patients falls result in injuries and can include serious injuries such as head trauma and fractures. Study shows that short staffing contribute to all most falls that occur in brain. Study shows that most falls that occur in brain and spine units are due to understaffed situation and patients try to help themselves because there are not enough staff to care for them. I also found that the main contributor to falls is confusion because confused patients are unable to follow commands. If I had if I had the chance to redo the same assignment, I would choose a different topic. This is because all the information about falls is kept private and not allowed to be shared to the public. Also, it was very hard to find the needed information because I did not have access to it. At conclusion, um, we as discussed, Caring Health is a non-profit healthcare system that was founded in 1964. Caring Health can be defined by five principal values, which are caring, competent, collaborative, trustworthy, and innovative. Like in any other healthcare organization, patient falls is a concerning issue at Caring Health. For this reason, patient safety is their top priority. Brain and spine unit is one of the hospital units with the highest number of falls. This is because most patients on this unit are cognitive impaired, confused, physically impaired, and impulsive. Due to cognitive impairments, the patient in brain and spine unit don't remember that they are physically impaired, so they try to walk without assistance, which most of the time results in fall. Almost falls that occur in brain and spine unit, bedrooms are on, but the patients are impulsive and very fast to get up, and by the time the bed exit is inside, the patient is already on floor. Brainstorming is needed at current hospital for quality improvement implementation. Because most falls in the brain and spine unit occur on cognitive impaired patients, measures like hourly safety rounds, hourly checks with toileting, top side raise up, and placing the most confused and the most impulsive patients close to nurses station will help in preventing falls. The last slide is for reference page. Um, in case you need any more information about what we discussed, you can find it on this page. You can just go to this page and find any more information you may need. Thank you for listening.